Hello, thank you for listening to this presentation. My name is Steve Eyre, I'm CEO of ProLung. We're involved in lung cancer and we bring a brand new digital health solution to improve the outcome for lung cancer patients that could have a major impact on the way that lung cancer is handled around the world. We're located in Salt Lake City and we are easily 1 or 2 quarters away from an approval by our FDA or in the United States. We're a publicly reporting company, meaning everything about the company is disclosed and available on government databases. However, we do not trade. Now, what most people need to know about lung cancer before I can proceed is that more people die of lung cancer than the next 4 cancers combined. And that relationship holds not just in Europe and US, but all around the world. And in particular, it's a massive social issue that impact investors are interested in the China workplace. Our solution is to take advantage of the opportunity that exists for early detection to expand and improve the survival of lung cancer by as much as 38%. How does this happen? Well, today, 5-year survival of lung cancer is 17%. With our solution in place, our test, it's possible to accelerate that and take advantage of a 38% improvement by getting to people to treatment faster. Now let me pay that off for you because it's a huge statement to make. First, the current standard of care is a CT scan. These are generally available at regular doses, but there's also a low-dose CT scan that's now reimbursed in the United States and soon to be reimbursed in Europe. That scan frequently discovers nodules. These nodules are well characterized in every way, but it's not known whether they are malignant or they're benign. And the current standard of care, NCCN guidelines, RADS, and the other institutes that publish these guidelines require that up to 7 additional CT scans are given before a person is determined to be benign who carries a nodule. We are in the nodule business, and what we do is we reduce that 3.5-year period to 1 day with a 30-minute non-invasive test. It's called the electropulmonary nodule scan, and it's a reasonable price. And I don't need to tell you how much you can save when you compare that with the downstream CT scans that are required to track a patient. You know, finding a nodule that doubles in growth and taking that long is a lot like discovering a risk and waiting for the risk to actually have an impact before you do something about it. And that's ridiculous. So there's a lot of interest today in the current standard of care improvement that we bring. Getting patients to biopsy sooner, or perhaps relaxing the vigilance required for those patients in the future. We're approved in Europe and selling in Italy, Germany, and Switzerland. And we're expected to sell by the 3rd quarter of the year in the United States. We're raising money on an offering that currently is a $1 a share offering. We're a Delaware C corporation, and we're unique in the sense that we meet these patients who have unprecedented unmet need. I can't think of a disease that's more severe than a lung cancer with an application that has the potential of dramatically improving their outcome. Now, what's interesting about us as a company, and from an investor perspective, is we're trying to tee up 3 key valuation improvements. First, we were ready to go public now. We will wait until just prior to our FDA. We'll get a pickup from our FDA and perhaps another one from the SFDA. And following that, we'll be working with strategic investors to maximize distribution around the globe. We're actively looking for foreign distribution. We're actively looking for investment. I'd like very much to work with anyone involved in this. Our US partners include every major lung cancer center across the country. And I have Stanford, MD Anderson, Harvard, Loyola, Huntsman Cancer Institute, and many, many others. These groups really are the plurality. They're most of the pulmonary talent and opinion in the United States. I look forward to doing that. That's SCE@ProLungDX.com, +1 801 631 7288. Look forward to your inquiries. Thank you very much.